And in previous class we have discussed up to 25 questions. So now let us see the 26th question of this community health. So here you can see the first question. All current cases existing at a given point in a time or over a period of time in a given population is. All current cases existing at a given point in a time over a time or over a period of time in a given population is. Prevalence, incidence, epidemic. The answer is prevalence. The next question. The number of new cases occurring in a defined population during a specified period of time is. The number of new cases occurring in a defined population during a specified period of time is. Incidence, prevalence, epidemic. The answer is incidence. The next question. Disease frequency is measured by. Disease frequency is measured by incidence and prevalence, rate and ratio, frequency and distribution. The answer is incidence and prevalence. The next question. Mortality means. Mortality means sick rate, death rate, birth rate. The answer is death rate. The next question. Epidemiologic tool of measurement. Incidence and prevalence, rate, ratio and proportion, frequency and distribution. The answer is rate, ratio and proportion. The major foundation of epidemiologic approach. Major foundation of epidemiologic approach. Asking question and making comparison, rate and ratio, measurement of mortality. The answer is asking question and making comparison. Okay. The next question. Branch of science which deals with treatment of epidemics is. Branch of science which deals with treatment of epidemics is. Epidemiology, sociology, community. The answer is epidemiology. Then next question. Epidemiology is derived from the word. Epidemiology is derived from the word epidemic, pandemic, environment. Epidemic, pandemic, environment. The answer is epidemic. The next question. Social medicine was first introduced by. Social medicine was first introduced by Joseph Lister, Jules Gorin, Edward Jenner. The answer is Jules Gorin. The next question. Hygiene is a word which is derived from. Hygiene is a word which is derived from. Latin word, Greek word, French word. The answer is Greek word. Hygiene is derived from Greek word. The next question. Science of health and embraces all factors which contribute to healthful living is known as. Science of health and embraces all factors which contribute to healthful living is known as hygiene, cleanliness, personality. The answer is hygiene. Then next question. Restoration of personal dignity and confidence is. Restoration of personal dignity and confidence is vocational rehabilitation, psychological rehabilitation, physiological rehabilitation. And the answer is psychological rehabilitation is the restoration of personal dignity and confidence. The next question. Restoration of capacity to earn livelihood. Restoration of the capacity to earn livelihood. Educational rehabilitation, social rehabilitation, vocational rehabilitation. The answer is vocational rehabilitation means restoration of the capacity to earn livelihood. The next question. Restoration of family and social relationship is. Restoration of family and social relationship is. Social process, social rehabilitation, social satisfaction. The answer is social rehabilitation. Then next question. Individuals suffering from an impairment and disability. Individual suffering from an impairment and disability. Disability, handicap, impairment. The answer is handicap. The next question. Substance which suppresses or neutralizes bad odor is. Substance which suppresses or neutralizes bad odor is. Perfume, deodorant, detergent. The answer is deodorant. The next question. Substance which destroys harmful microbes. Substance which destroys harmful microbes. Bacteriostatic, disinfectant, detergent. The answer is disinfectant. The next question, substance which destroys or inhibit the growth of microorganism. Substance which destroys or inhibit the growth of microorganism called disinfectant, antiseptic, bactericidal. The answer is antiseptic. Next question, MMR vaccine is given at 9th month, 15th, at 15th month or at 2 years. The answer is 15th month. The next, measles vaccine is given at 15th month, 9th month, 1 year. The answer is 9th month. The next question, ultimate objective of surveillance is. Ultimate objective of surveillance is treatment, prevention, detection. The answer is prevention. Then next, universal immunization program was launched in India. Universal immunization program was launched in India 1974 May, November 1985, January 1978. The answer is 1974 May. Then next question, expanded program on immunization was launched in India. Expanded program on immunization was launched in India 1950 June, January 1978, May 1974. The answer is 1978 January. The next question, global immunization program was launched at January 1950, 1974 May, 1980 October. The answer is May 1974. Then last question, most powerful and cost effective weapons of modern medicine for prevention of communicable diseases. Immunoglobulin, active immunization, antitoxin. The answer is active. Immunization is a powerful and cost effective weapon of modern medicine for prevention of communicable disease. So once we recall all MCQ, from 25th onwards, 25th question, 26th question, right? All current cases existing at a given point in time or over a period of time in given population is prevalence. Then the number of new cases occurring in a defined population during a specified period of time is incidence. Disease frequency is measured by incidence and prevalence. The next question, mortality means death rate. Then epidemiologic tool of measurement, rate, ratio and proportion. Major foundation of epidemiologic approach, asking question and making comparison. Then branch of science which deals with treatment of epidemics is epidemiology. Then epidemiology is derived from the word epidemic. The next question, social medicine was first introduced by Jules Corren. Then hygiene is a word which is derived from Greek word. Then science of health and embraces all factors which contribute to healthful living is known as hygiene. The next question, restoration of personal dignity and confidence is psychological rehabilitation. Restoration of capacity to earn livelihood, vocational rehabilitation. Then restoration of family and social relationship, social rehabilitation. The next question, individual suffering from an impairment and disability, handicap. Then substance which suppresses or neutralizes bad odor, deodorant. Substance which destroys harmful microbes, disinfectant. Substance which destroys or inhibits the growth of microorganism, bactericidal, antiseptic. Then next, MMR vaccine is given at 15th. The next question, measles vaccine given at 9th month. Then ultimate objective of surveillance, prevention. Then universal immunization program was launched in May 1974. Then expanded program on immunization was launched in India, January 1978. Then global immunization program was launched at May 1974. And last question, most powerful and cost-effective weapon of modern medicine for prevention of communicable diseases, active immunization. So this is all about the MCQ from community health. Thank you all.